Hello, this is Dr. Robert Bouvier and Roger Ellsworth with Dr. and You, and you've come to this video to learn a little bit more about the Community Paramedic Program, and we've got something to ask them right off the front.
We're asking for your support for an amendment to Public Act 368 of the Public Health Code to add sections 17039 and 17539 to the Public Health Code in supporting the Community Paramedic Program.
So, what is the Community Paramedic Program, and why was that born out, and how is it different from using paramedics in other ways? Well, it was born out of the need to decrease cost and improve quality here in Michigan. And we looked at who was best suited for that, and community paramedics are the perfect person to do that. And we did our research throughout the country, and we found that Minnesota had the best research, and we partnered with them, and now are collaborating with them, and they just finished their 2-year project where they took 5,000 at-risk patients, inserted their community paramedic program with only 5,000 at-risk patients, and they were able to reduce the cost of health care after the expenses of the program by $10 million per year. That's a huge statement, absolutely huge statement. They did it by decreasing hospital admissions by 50% and by decreasing the emergency ambulance visits by 77%. Overall, again, they saved, for 5,000 patients per year, they saved $10 million. Now, if you take a look at how that extrapolates here in Michigan, we've got approximately 9 million people. 10% of those people are at risk, so that's 900,000. If Minnesota saved $10 million on 5,000 people, just think what will happen when we expand that out to its greatest extent for 900,000 people. You do the math. It's a huge deal. So 3 things that we want to accomplish here with this bill, and I want to thank Senator Dave Robertson for having a strong interest in this, and April, his legislative director, for working so hard in this. You guys are just absolutely wonderful to work with, and thank you very much. But 3 things we want to accomplish in the bill is, number 1, we want to work under the direction of the primary care physician and some subspecialists. This bill will help us do that. The reason that we want to work under the primary care and subspecialists is because that's where the greatest need is. Primary care people need additional physician extenders to do a lot of the things that need to be done. And if there's a PowerPoint that you can look at if you want to, that Senator Robertson has to go over that. Number 2, we want to provide for education and training. That's education and training for the community paramedic, and we want to create a billing process to be able to get this paid for. So all 3 things have been accomplished in this bill, and thank you, April and the Senator, for putting this together so much, and thank you to our friends up in Minnesota to helping us put this all together. By the way, the people in Minnesota feel very strongly that this is the correct way to walk through this legislation process. So the bottom line here is, when we're extrapolating this and talking with our consultants, we feel that we'll be able to see about 15,000 plus new jobs be created over the next few years here in Michigan, and that we can have a huge cost savings potential for the total cost of medicine in the billions. You can do the math. If we can save $10 million per year with applying what we learned in Minnesota with only 5,000 patients, just imagine what we can do with the 900,000 patients that are here in Michigan that are at risk from a medical standpoint. So we want you to do, the action item is number 1, support the bill.
Support the bill. Public Act 368, adding sections 17039 and 17539.
You can, if you have any questions, you can, of course, get a hold of the Senator in April. And if you want to be added to an email blast every 2 weeks that comes out to give a little update as to what's going on with the community paramedics here in Michigan, then just get a hold of us at admin@drandyu.com. That's ADMIN at DRANDYOU.com. Again, this is Robert Bouvier and Roger Ellsworth with Dr. and You. Have a great day.
Thank you.